GMC ANANTNAG, on behalf of the organizing committee, welcome you all to this continuing medical education program on the theme Innovations and Advances in Public Health, organized by the Postgraduate Department of Community Medicine, Government Medical College, Anantnag. We are deeply honored to have with us a galaxy of distinguished dignitaries and guests. It gives me immense pleasure to welcome Professor Dr. S.M. Salim Khan, Head, Department of Community Medicine, Government Medical College, Srinagar. We thank you, sir, for joining us and enriching this occasion with your presence.
Innovative and actually a future of public health, that is artificial intelligence in modern healthcare systems. Not an expert of the subject, but I would like to take this liberty that none of us are in artificial intelligence. So I would like to start with a very basic question, that what comes to your mind when you hear the word artificial intelligence?
On those days, it was Broadway cinema. As a kid, in fact, I was in first in GMC. I went there, and I would see a scientist in the movie.
Unless we learn about it. So as you said, the last point. So even our medical education by the NMC is way behind what we are expected to learn in the contemporary times. So they are changing syllabus now and then, but
at the same time, AI should be a complement to the human touch of a doctor, right? That thing should not be missing, and we should actually use AI.
An administrator comes to their hospital, or maybe someone from the secretariat or HME department, or a deputy commissioner, and goes to the concerned in charge or the doctor and asks us about the health care being provided to the patients. The response is, sir, we are providing excellent quality health care. Then the administrator goes to the ward and asks the same question. And the answer lies with one of my postgraduates, Dr. Arthur, but I think he is within my. And the answer lies with one of my postgraduates, Dr. Arthur, but I think he is within.
Improve their family options. So then the thread of this study is that it can be beneficial.
how many of us are using social media currently while this session is going on? So there is no deficient data on or addiction to social media. So anyone, what is the addiction to social media? What is that? Your hands are uncontrolled and goes to phone and open it. Now, even if there is no message there is no mail here, but you go and touch the screen, that is addiction. So your uncontrolled urge to access your phone, even if there is nothing, is now one of the biggest pandemics. The social media or screen addiction is one of the biggest addictions which we are still not able to find the solutions to it, and we are getting more and more people addicted to it. So in India, it's
novelty seeks, reward dependence, hobbies of learning from family science, and impulsive type of features develop होते हैं. They always feel that कि कहीं ना कहीं चल जाते हैं. शायद अब ये ट्रेंड्स डेवलप होने के बाद इनका साइकोलॉजिकल इफेक्ट वापस भी पहुंच के कुछ उसमें अगर आप दिन भर भी यहाँ बैठेंगे, I will give 100 of examples, आप सुनते रहेंगे. ADHDs are very common in statistics. Autism, survey भी करेंगे as pediatrician that common symptomologies people young people जो बच्चे मोबाइल देखते हैं more than 2 or 3 या मतलब हमारे ट्रेड्स पहले हमें वो देखने पड़ेंगे। सेकंड ट्रेड जब हम 6 साल के ऊपर बच्चों को देखते हैं एग्री विद डॉक्टर मंसूर भाई सेइंग दैट हमारा रिवॉर्ड डिपेंडेंस काम करना शुरू कर देता है। तो वन ट्रेड दे आर रिवॉर्ड डिपेंडेंट, दे आर वेरी इम्पल्सिव at the same time
use a mobile phone. The wife is a traditional lady, right? They were once people would get retired, and this was a quite wonderful statement. They would say that when a husband retires, the wife gets a full-time husband. So, but what I now see is that in many families now there are fights breaking out.
Dependency, you can recognize it at any age, at any point of time, and even I have seen very old people in our households, and then their family members, they say that now our grandfather is addicted to this social media. It is not that it is not existing. The problem is that what the set rules and definitions we are having at this point of time, we are having problems with that. Because our digital addiction cannot be like cocaine addiction. It cannot be like alcoholic addiction. It cannot be like cannabis addiction like that. That is the problem. But let me tell you, everybody feels that. Learned people feel that definitely there is a dependency and there is addiction. Maybe after some years or so, world bodies will come with new definitions and they will come that it doesn't exist. I will start my viewpoint.
उनका हर एक का शिकायत एक कि हमें बोला गया था कि इसके माँ ने लेट कर इसके बाप ने भी लेट बात की। अगेन वो जो सेल्फ स्टीम न्याय फिर आपस में घर में होता है या हश और नश के बीच में या हस्बैंड और वाइफ के बीच में, वो भी लीड करता है साइकियाट्रिक प्रॉब्लम टुवर्ड्स दिस चाइल्ड। अब आप देखिएगा मंसूर एग्री करेगा मेरे साथ में, देखिए हम देखते बच्चों को, मैं बच्चों को देख रहा हूँ लेकिन एडल्ट्स में जब वो जाते हैं साइकियाट्रिक प्रॉब्लम्स पहले से बहुत डेवलप हो चुकी होती है। फिर जब हम उनका चाइल्डहुड एक्सपीरियंस करते हैं तो वहाँ पे ये चीज़ निकल के आती है। तो ये चीज़ें सेल्फ स्टीम से पहले ही बनी होती है। आपने एक बच्चे को मोबाइल थमा दिया, वो 7th-8th क्लास में पढ़ता है, आप उसको चेक नहीं कर रहे, काउंटर नहीं कर रहे, बोल नहीं रहे कि आपको लगता है कि वो नाराज हो जाए कुछ और करेगा, तो उसका लेटर ऑन सेल्फ स्टीम तो होगा लेकिन वो वैसा नहीं होगा जो कोई खिलाड़ी होगा।
In psychiatry, there is a system of classification. XCs, one is like other disorders, and XCs two में addictions. So these addictions are taken separately. That they are actually a change in your behavior and personality. But क्या देखा गया है कि all these addictions they come to attention only once they develop XCs one disorder. Once you depression disorder, they develop an anxiety disorder, then they come to attention. And reverse is also true. A person who has depression, he does not feel like talking to people around. He goes to sick leave, and many times it initially gives him some peace, solace, and he's scrolling through the reels. What happens later that the pleasure from the reels is not coming once he's doing it for a few weeks or months, and after that he sees everybody on that sick leave is actually very good in his life. They are all celebrities for another place. They are all doing great, and he is the only loser in the world. That's why his kind of personal well-being and esteem, and later it kind of adds to his basic disease, which was, for example, major depression. So the circle is actually continuing there. Same happens in anxiety. For example, anxiety people have usually what they have is an impulse control issue. They cannot control their impulse of fear. They cannot control their impulse of washing. They cannot control their impulse of doing something. So the relationship is exactly bidirectional. There is a lot of data on it. A lot of meta-analysis have come up. South Korea, China has a lot of studies regarding this bidirectional kind of relationship between these substance use, digital use, and this axis one.
Cognitive domain, we have social domain, we have speech and language domain, we have motor, so whether it's a fine motor or it's a gross motor. Every domain for its maturity, it requires interaction with the environment. Now, if we take the cognitive domain, when we are having a child who is not introduced to a proper environment for the development of the cognitive domain.
Honorable Principal Ma'am, Professor Dr. Rukhsana Najib, esteemed ex-principals, Professor Dr. Shaukat Jilani, Professor Dr. Tariq Said Qureshi, my revered teachers, UG as well as PG, Professor Dr. Salim Khan, Professor Dr. Shehnaz Ma'am, respected HODs, my fellow colleagues in Government Medical College Anantnag, worthy faculty from other medical colleges, desk officers, GMCA, and all delegates. Assalamu alaikum and a very good afternoon to all of you. Firstly, I feel greatly honored and privileged to welcome you all to this one-day academic feast, first of its kind for postgraduate Department of Community Medicine. On behalf of the organizing committee, I extend a warm welcome and am delighted to see so many passionate healthcare professionals gathered in this august gathering for enhancing their knowledge and skills.
Not just about curing illness. It's about creating conditions in which people can live healthy and meaningful lives. Respected dignitaries on days, Professor Dr. Rukhsana Najib, Principal and Dean, and Chief Guest of today's CME, former and founder Principal Professor Dr. Shaukat Jilani Sir, former Principal Professor Dr. Tariq Said Qureshi, Professor Dr. SM Salim Khan, Professor Dr. Shehnaz Ma'am, our Chief Advisor and Organizing Secretary Dr. Mehbooba Rasool, distinguished faculty members of the dais, Professor Anju Ma'am, Professor Ashfaq Sir, Professor Abdul Majid Ganai Sir, and all residents, dignitaries and the friends. Assalamu alaikum and very good afternoon. On behalf of the Postgraduate Department of Community Medicine, Government Medical College Anantnag, I extend my heartfelt greetings to all the distinguished dignitaries, esteemed faculty, delegates, guests who have joined us for this one-day CME to comment 2025 Innovations and Advances in Public Health. Your participation truly elevates the significance of this academic event. Public health today stands at a fascinating crossroads where science meets innovation and tradition blends with the technology. The last few decades have seen tremendous progress in how we understand, prevent, and manage disease.
Principal Government College Anantnag, Professor Shaukat Jilani Sir, former Principal, Professor Tariq Said Qureshi Sir, former Principal GMC Anantnag. All the three have been my teachers, so my reference to all the three here. Respected Dr. Shehnaz Nabi, she has been my senior in GMC Srinagar also, the organizing chairperson and organizing secretary. Respected Professor Abdul Majid Ganai Sir, Professor Anjum Ma'am, Professor Ashfaq Sir, my faculty colleagues from GMC Anantnag, all the medical colleges, delegates, Assalamu alaikum warahmatullahi wabarakatuh. I am highly grateful to the organizing committee for inviting me and involving me in this first COMED 2025 organized by Postgraduate Department of Community Medicine, GMC Anantnag. It gives me an immense pleasure. I am speaking my heart out to see my next generation working so hard and bringing community medicine to this level, and I believe this is an opening for all other medical colleges in J&K, especially in Kashmir.
Sir Shehnaz, dignitaries on the dais, dignitaries of the dais, especially those coming from our mother institution, GMC Srinagar, SKIMS Medical College, SKIMS Medical College, Pemina, Baramulla Medical College, Wara, and Rajouri. Congratulations for arranging a CME on innovations and recent advances in public health. Seminars, CME, conferences, journal clubs form a foundation of medical colleges. The CME should not be restricted to the four walls of this college, but should be presented at state level, national level, international level. This college has a solid foundation, academic foundation. When in 2021, first international conference was arranged by this medical college. This medical college was a barren land, and this faculty, Professor Rukhsana Najib, Professor Shaukat Jilani, and all others worked day and night and transform this barren land into this flourishing medical college. And we put our hands together for this worthy principal, the faculty and the student and staff of this college, that a college of this magnitude is before your eyes. It is a glorious college and this college has a bright future. The academic scenario of the college changed in 2022 when 125 seats of DNB were allotted. This was a one-time major relief to this college. And the presence of DNB students in the college changed the whole scenario, teaching, learning, and sharing of knowledge.
Today's it is yet again a pleasure for me to be here today and to participate in this CME on technology as applied to medicine and the prevention of disease. Ordinarily, non-clinical subjects are always short of funds and they are unable to do on an extensive scale these academic programs, but they should go to the credit of the department, its faculty, and the current principal, Dr. Ruxana, that she's encouraging it and she's funding it also. And I feel personally, and the clinical departments who are better off in this matter should take the lead and take this college and conduct regularly these CMEs, etc., conferences, national, international, and local conferences to make medical education and research easily available and easily we can comment on those, we can learn from each other's experience, and it will have in that situation we'll have a better future for our college and for our medical students and the overall healthcare system of the
Dr. Mehbooba, Dr. Iftikhar, and so many dignitaries who have come from different parts of colleges, from Baramulla, from JBC, from SKIMS, and from GMC Srinagar. And my faculty members, my HODs, my professors who are here, the medical superintendent. It gives me immense pleasure that in just 6 years, this department, this medical college has progressed. It's really heartening to see that you people are doing an excellent work as far as the job is concerned, as far as the conferences are concerned. Seeing this department written as postgraduate department of community medicine, it's a big achievement in just 6 years. In GMC, it took 35 to 40 years to start the post-graduation. And if it is a primary DNB, that means it is a 3-year course. They are the MD students, they can come as a faculty. So the credit will not go to the current principals. It is the hard work and the hardships I know that were beared by our ex-principals. How they had difficult times. Professor Shaukat was one of it. Then Dr. Said Tariq Qureshi and Dr. Anju Farhan also. It was difficult for me also, but during that time things had settled a lot because COVID had settled. In COVID it was really very difficult to work. And during COVID, I know the role of preventive medicine. Like when I was doing MBBS, it was social and preventive medicine. Then it changed to preventive and social medicine. Now, if I say SPM, they say no, ma'am. It is community medicine. So it is a community medicine which came out with the vaccine for COVID, and we saw a lot of people died in the first wave. Then, because of the advent of the vaccines, the mortality decreased, and in third one we didn't see any mortality, but at the same time there was mutation of the virus also. So this means the department of SPM, I would say community medicine, is really very important. The way you could eradicate smallpox, why don't you eradicate so many other diseases? Like polio will be eradicated soon. And what about tuberculosis? So work hard. And what about rabies? Why don't we prevent rabies? We have to prevent the disease because a lot of exchequer will be changed, will be saved. We see very little patients getting survivals after rabies. So this department overall
When they talked to me so many times, I said, have you ever gone for any CME? They said, no, we have celebrated Tobacco Day, we have celebrated Reddy's Day. I said, what about the community, this SPM, in which you will have a CME or a conference? They said that who will sponsor? Start these medical colleges because of the presence of the professors. We should never ever forget their role. We cannot ignore them, we cannot neglect them, we cannot just close our eyes. Because they were the professors who volunteered that time and they had to travel so far. I know what it means traveling 75 kilometers daily. So the basis of these hospitals is because of these professors and the founder principals who have really worked, I think, so hard in difficult conditions. So congratulations to the whole department, especially Dr. Shehnaz and Dr. Fozia for getting this, CME done today, and the topic is innovations and advances in public health.
ट्रैकिंग पे हमको संभव मिलुଛି
you have several testers incorporated, and that is connected to the cell phones that I got. But that, what is the system for health analysis and the inference?
Yes. So in analysis, what I told, like suppose you can say that after collecting data, we have cardiac risk score, diabetic risk score, we are building a generator.
There were certain people like the elderly patients in Srinagar that we had come across. Why we have an idea about this, but fortunately there are a couple of friends of mine over here, Dr. Rup is there, Dr. Jatinder Mehta was there. We came across setting up district disaster management centers, divisional COVID control room, and we were connected in the digital space around that period of time. And there were a number of people who got connected around that period of time. Even certain places like teenagers in New York, they stayed actively.
In low and middle income countries like India. Cardiovascular diseases killed 19 million, cancers 10 million, chronic respiratory diseases 4 million, and diabetes over 2 million, which included kidney disease deaths caused by diabetes. So these 4 groups of diseases account for 80% of all premature deaths.
They are at the advanced stage, so they are going to the hospital, they are going to the family, and they are in some suffering. So this assessment and primary prevention and secondary prevention are the cornerstone for our
My personal comments regarding the CME would be I am little bit confused whether I have to use the technology or I don't. Because in the morning session I was told that it's an addiction, and in the afternoon I was told by Rabani and others that it is there is no way out of it. So you have to get used to it. So at least we will go home with this message that okay, we have to delve more deeper into it to find out the actual answer, whether we have to use it or not. Okay. It is indeed my privilege and honor to present a vote of thanks on behalf of Department of Community Medicine, Government Medical College, Anantnag, as we conclude today's CME on innovations and advances in public health. At the outset, I express my deepest gratitude to our worthy principal and dean, Professor Dr. Rusana Najib ma'am, for her constant guidance, encouragement and unwavering support. Her visionary leadership continues to inspire academic excellence and innovation within our institution. We are sincerely thankful to our distinguished speakers and experts who graced us with their time and expertise, sharing invaluable insights on emerging innovations and challenges in public health. Your contributions have truly enriched our learning experience.